The Replicator Research System made it possible to explore how people use their teeth. The actual chewing movements of a variety of subjects were reproduced with amazing accuracy. The number of different types of displays of total jaw movement varied from computer-drawn plots to representations that combined both teeth and condyles, which greatly simplified the student's understanding of a complex subject. Metal condyles were one of the visual displays. They were related to the mandibular teeth by using patient coordinates obtained with a caliper measuring device described in the textbook. Articulators were similarly mounted in the replicator, demonstrating how their condylar controls moved during chewing by using the data recorded on magnetic tapes. Also, a mandible oriented to the subject's coordinates helped visualize movements of selected points. Here the incisor point is tracked with the aid of a small metal sphere from a ballpoint pen glued between the incisal edges of the two incisors. A previously recorded frontal plane incisor point plot of this subject is suspended over the display mandible, which is being moved by the same chewing data. The part of the plots represented by the opening movements have been eliminated to show the characteristics of the closing movements. The sharp apex at the top is the intercuspal position. The dashed lines to the right and left are the limits of lateral movements established by the gliding contacts of opposing canines.
The computer plotter shows the incisor point begins movement down the middle, moves wide lateral early in the closing stroke, and then coincides with the border path up to the intercuspal position. The computer draws a timing dot every 20th of a second, and then an arrow on the closing stroke. The arrow is also placed on the condylar and molar plots at the same time point. During final closure, when the movement path coincides with the border path, the forces between the teeth average about 20 pounds and then increase to about 60 pounds at the intercuspal position. In these chews, in the unworn dentition, they stop at the sharp apex of the intercuspal position. Now we'll compare them to a severely worn dentition and see a marked difference. The computer plotter also draws the movements of the condylar points that correspond to the same movements that we were watching at the incisor. This frontal plane view of the incisor point shows the cross-arch opening, movement toward the food side, placement of an arrow on the closing path, and no pause at the intercuspal position, which is very ill-defined in this subject. The flat top of the severely worn dentition plot is much different than the sharp apex plot of the normal dentition.
A close examination of the movement characteristics of unworn, healthy occlusions shows closures into the intercuspal position ending with precise, definite stops. There is no evidence of further sliding of the teeth, only a pause before opening begins again. By contrast, the subject with severely worn occlusion makes closing movements characterized by lateral sliding across all of the teeth. The chewing pattern follows the bruxing wear facets. In another display, a mandible is mounted in the replicator using the coordinates of this subject with a chewing series superimposed over it. The mandible in the background display is being moved by the stepping motors, which are being driven by the subject's recorded chewing data, which is the same method used to show the movement of the subject's casts. A 2 millimeter square grid helps to understand the magnitude of the sliding of the teeth as they pass through the intercuspal position without stopping. The computer also draws plots in 3 planes of molar movement similar to the incisor plots. Zooming in on the frontal plane view gives a clear close-up picture of the molar during chewing. The subject with unworn teeth is again shown to emphasize the stability of the intercuspal position. In the frontal plane view, it is clear that the canines control the lateral centering of jaw closures, but the incisors do not share a similar role as seen in the sagittal view. This chewing series contains only the closing plots. It is oriented to the dashed lines, which show the location of the terminal hinge movement posteriorly, and the retruded contact point is shown near the top of this arc. The top or apex is the intercuspal position, and the line drawn anteriorly is formed by the tooth-guided protrusive movement. The narrow range of closure entry into the intercuspal position is controlled by mechanisms other than the teeth. There was no evidence that the mandible reaches forward during the final portion of the closing strokes. Subjects who had no anterior tooth guidance possibilities had the same rearward closing pattern. Again, the subject with worn teeth is used to compare frontal and sagittal plane views of incisor chewing plots. In the absence of any anterior tooth guidance, the sagittal plots show the same narrow range of retruded closures. The answer to much of the misunderstanding of total jaw movement during chewing can be found in closer examination of the movement of the condyles. Jaw movement during chewing is not a symmetrical up and down midline event. Of course, some closures occur in the midline, but typically adults with good occlusion open down the midline and closure commences with a lateral swing to the food side. Lateral closures, therefore, affect the timing of the return of the condyles to their intercuspal positions. The working side almost immediately makes a more rapid return to its posterior and lateral position, where it holds until the teeth pass through their final stages of reaching their intercuspal positions. One could predict that the early return of the working side condyle to a lateral and posterior position would have an effect on molar closures into their intercuspal position, which it does. The working side molar typically shows a forward and medial movement during its final closure into the intercuspal position. This subject's slow motion chewing series demonstrates typical wide lateral working side opening strokes and then a posterior turnaround, bringing the closing molars upward and forward to their starting position. Here, the subject, whose casts were just shown, uses the occlusal index that gives the computer a 0 starting and ending point for each chewing series. A variety of food consistencies were tested. Here the subject is chewing raisins. The only instructions given the subject during the test was to chew the food on one side, then alternate and chew the food on the opposite side. In this next subject, the opening part of the chewing cycle has been deleted to better focus on the nature of the final closing strokes. The two pencil lines are made by first drawing a vertical line on both upper and lower teeth with the cast in the intercuspal position, and then stopping the replicator at the most posterior point of the working side closure to mark the retruded line on the upper tooth. From its most posterior position during chewing, the working side condyle makes a final forward and upward movement, which matches the final forward and upward movement of the molar. The rhomboid figure placed at the incisor point has been used to describe how chewing takes place in the horizontal plane, but it does not match the replicator drawing of chewing in the horizontal plane. Timing dots labeled 1 through 8 on this typical chewing cycle reveal the simultaneous relationships of incisors, molars, and condyle. The Gothic arch tracing has been used in prosthodontics to show the lateral retruded borders and the apex for identifying a centric relation position. It has also been used in the literature to describe where chewing takes place. A red line connects the incisor and condyle positions at point 7, which is the most posterior and lateral point of the working condyle's closing movement. It then traces through point 8 back to point 1. The computer has placed the same numbered orientation timing dots on all of the plots to describe total jaw movement. The incisor closure is a direct medial movement through point 7 and 8 to point 1, while the molar's final closure is forward and medial in direction, passing through point 7 and 8 and ending in the intercuspal position. Multiple chewing plots in 3 planes again illustrates how the Gothic arch tracing gave a misleading picture of where chewing takes place. The shape of the articular eminence is easily demonstrated by using one of the simple recording devices. The eminence makes up the superior wall of the fossa, under which the disc condyle unit translates. Its curvature shows a fairly constant 3/4 inch radius arc. Its steepness can be adjusted to match that of the patient. Variations in the curvature, although not common, can be reproduced in some articulators. The replicator had the unique capability of relating a subject's actual condyle movements during chewing with the condylar controls of articulators, a demonstration dentists had never seen before in any previous studies. The articulator itself was mounted in the replicator, and its lower member moved by the stepping motors, which were driven by the chewing data stored on magnetic tapes. On the working side, the condyle follows the eminence on opening and often returns on a slightly inferior course, as shown in this single working side chewing plot. This is an example of a working side chewing series demonstrating the curvature of the eminence, which is the superior tracing during opening movements, but the closing tracings are inferior to the opening. The amount of vertical separation of the closing working condyle from its protrusive opening increases both vertically and laterally as posterior movement is made, which would indicate that the lateral undersurface of the fossa differs slightly from its central area used for protrusive opening movements. Or a thicker lateral part of the disc contributes to the anatomical basis for the separation, which is not seen on the non-working side. During chewing, the non-working side condyle shows the protrusive opening and the non-working closing courses are not separated, and they faithfully follow the curvature of the eminence. There is no Fisher's angle, as seen in pantograph recordings made 55 millimeters lateral to the head. This is a series of non-working side chewing movements, which means the subject is chewing on the opposite side. The opening and closing tracks are the same. Here are 3 views of a non-working side chewing series showing how the condyle movement is related to articulator controls. It shows the sagittal, frontal, and horizontal plane movements, plus a timeline duration of each of the cycles. The sagittal view matches the shape of the eminence of the articulator control. The sagittal plane chewing plots are the same ones shown in the head-on frontal view on the right. The narrow movement range in and out of the intercuspal position at the top indicates this subject has almost no lateral translation or Bennett movement. The horizontal plane view of chewing relates to the Bennett angle guide adjustment of the articulator, which will be discussed later. Dr. Robert Lee, a California dentist, developed a condylar movement recorder that used air turbine drills to engrave a subject's condyle movements in clear plastic blocks. The drill is recording the non-working condyle movement, which was previously demonstrated by other methods. Dr. Lee also developed a method of directly transferring the condyle movement pattern of the patient, which was engraved in the clear plastic blocks, into milled articulator controls. The first step was to mill the straight protrusive movement. Here you can see how the milling followed the patient's protrusive recording. After the protrusive movement was engraved in one side of the clear plastic blocks, they were then swapped left for right to use their blank side for recording the lateral movement. The patient's lateral movement recordings are now being milled. This particular patient is one that had excessive lateral translation or Bennett movement. The 1/4-inch condylar spheres of the articulator match the rounded ends of the milling drills. A centric holding latch located in the center of the articulator was necessary for establishing and holding a centric position. Dr. Lee's research was an important landmark in dentistry. He was the first to demonstrate such a clear and understandable picture of the total condylar movement space. This background knowledge became the basis for the development and use of simplified instrumentation systems. The Lee articulator was ideally suited for mounting in the replicator. The analog controls were sectioned, exposing a clear view of the condylar spheres of the articulator, which now could be observed as the mandible moved during chewing. Vertical shaking of the retruded working condyle results from crushing carrots. Now the subject's teeth can be observed that were chewing the carrots just seen in the condylar movement series. The timing of the two condyles is clearly demonstrated in this view, showing the early return of the working condyle in the foreground and the lagging return of the non-working condyle in the background. Now the picture changes as we see the non-working side closures of both the teeth and the condyles are returning directly to their intercostal positions. In the foreground, the chewing action of the non-working condyle can be compared to the chewing movement of the teeth. The opposite working condyle shows its characteristic speedy return before the non-working side. When a sectioned analog is viewed in the frontal plane, the condylar sphere during chewing shows how it translates down and back up the eminence in a fairly narrow track, quite different from the angled Bennett guide concept used in early articulators.